Yes, people, welcome to the platform today. It's on Tuesday, a very chilly day here where I am, and a very cold day. Makes me always have some cup of tea and a warm tea. So today we're gonna talk about some spectrum of diseases. We're gonna talk about spectrum of diseases. We're gonna talk about brain complication. We're gonna talk about brain complications and the complications that are brought when a person starts to develop. There are some complications that you can start having when you're starting to develop, and those ones are the ones that we are going to talk about today. So everyone, everywhere you are, you are welcome. As I set up some things here. Check here. So as people come in, we want to understand some issues that occur when a person is having complications of the brain. You know, when there's complications of the brain can come from development when you are born, or they can manifest when you are an adult because of your own exposure to some things, lifestyle complications and others. Today there are several spectrum of diseases that we're gonna look. This is punctually. You can tell by the eyes and head shape his IQ is mid-60s. What do you mean by that? Pain. This is we talk about medical complications, health complications. We talk about health issues. So if you are here, you are new, welcome. Today we are talking about spectrum of diseases from the brain, right from when you are born to the time you grow up. Spectrum of diseases like schizophrenia, bipolar. There are some others like autism, but today we'll do autism. Before we do autism, we will talk about issues about how normal the brain and a person grows from conception. So if you are here, you are a new person, don't fail to subscribe, don't fail to ask any question, or don't fail to hit the like button. At least hit the like button as we continue to study. There are several spectrum of diseases that people have. Last time we talked about schizophrenia, and we saw how it was. It was a bit, people wanted to understand how it comes, and we learned about the mesolimbic pathway, mesocortical pathway. Onik is here. Onik, welcome. We have a new person called T-Pain Actual. You can tell by the eyes and the shape of the head, his IQ is mid-60s. So welcome everyone. As we wait for the others, you can like. You can hit the like button. You can subscribe if you are new. Welcome Onyx. Welcome to the platform. Everyone that is coming in, welcome to the platform. Here we discuss medical issues. Today's topic is spectrum of diseases that affect us as we grow right from conception. You know, right from conception is right from when you are in the mother's womb. So there, let me name some spectrum of diseases that can affect us. We have autism spectrum of diseases. We have autism, we have schizophrenia. That one we had covered it partially. Bipolar disorders, we will talk about bipolar, by the way. Obsessive compulsive disorders, substance abuse disorders. You know, substance can interfere with your brain, like bang, cannabis. All those, they can interfere with your brain. Anxiety disorders. Anxiety disorder is a very complicated thing. Sometimes it can effect of the brain. Depressive disorders. Depressive disorders can be because of some substance. So every new person that you are here, you are free to ask any medical question we discuss, and also interact with the people at the chat. Don't fail to give a like. If you wish, you can always subscribe to the channel. We talk about medical issues here. So welcome everyone, welcome to the channel. Today we will talk about autistic people, autism, spectrum of disease, autism, eating disorders, bulimia, binge eating. You see, all those we'll talk about them. Personality disorders, fetal alcohol spectrum disorders, intellectual disabilities, chronic kidney disease, kidney disease, we will talk about those, and chronic obstructive disorder. So welcome everyone, and I'm not seeing any like, or we are just beginning. So if you are watching, please hit the like button as we continue. Hit the like button as we continue. You know, likes sometimes they bring likes bring impressions. When you give me a like, it's good. You have it's like you have told someone else, we are online, please come and check out this, and that one is a good thing. Now, those are the things that we're going to talk about it today. So there are some things that we want to discuss about how when a sperm gets to the ovum, and then how the egg becomes a baby. Because if we understand how a sperm becomes a baby, then when we can understand how spectrum of diseases occur, like autism. That is how we can understand how some things come up and why some things, because people will ask you this, why can't they do anything to this person? Because now you can't do anything because it's a formation process, and it's good to understand. Let's talk about embryology. Kingdom, welcome. Thanks a lot of being here. It's embryology, and you know, embryology, sometimes when cells have fused, it is hard to unfuse them and start again. You get? So Kingdom, welcome. Onik, welcome, and everyone who is watching. Let's continue. It is important to note down some facts before we talk about schizophrenia, before we talk about autism, before we talk about anything else. Let's talk in an overview how a cell fuses, and then after it fuses, a baby comes in. Now we have this. I will put up these structures here. I'll put up some structures that people will watch, and then we see when let me get this. When a woman and a man make love, the sperm goes into we want to understand how some complications come through conception when it is congenital. So I'm drawing, let me get a good pen. I want everyone to understand how autism comes. And how some people are born with complications that are not known. Complications that you just get someone has a problem, and you don't know where this problem came from. You get? It is through birth. So welcome everyone. I welcome everyone to the channel, and let everyone, if you are new, just subscribe or give me a like. Subscribe or give me a like. It will be enough for a day, but stay around and listen to what we are gonna talk. Now this is over from a lady, and then this is, let me use a red pen, a blue pen, and this is a sperm. So when this sperm gets in this, I want everyone to understand how autism comes. When it fuses, it forms 46 chromosomes. So this sperm fuses and it becomes like, gets like this, through some chemical that bursts through your head. So when they fuse, they form some layers in your, this is the next step. Now the sperm has gotten into the ovary, and then they form something like this. You get morula. So this thing is called a morula. I'm going faster so that we can have some time. So morula is from the 3rd day to the 4th day. It forms something like this. Now the sperm has entered and you formed a morula from the 3rd day. So as we continue, you will form something that is called a blastocyst formation, a of cells. Now where the cells are now where we will start talking about these things. Let me draw it so that people can understand a blastocyst of cells. You sometimes wonder, what do a sperm and how do a sperm and an ova form this is it. Now it has come from a morula, and this one is a blastocyst. Now this is where problems come when it comes to, so this is a blastocyst. It is called a blastocyst. This is what is called a blastocyst. A formation of several cells. I want you to check it clearly. This is the sperm entering, and then this is the morula, and then we have a combination of cells. Now these cells, when you start having the child in a womb that is implanted, they start forming. It goes and implants to your uterus. It implants to your uterus. Let me draw a uterus. Let me draw a uterus. You see it. Now this is it. Now this is your uterus. Now it implants to the layers of the uterus, and then it starts to grow. So it is divided into 3 layers. When it goes into the uterus, this is divided into 3 layers. One is called the ectoderm. Let me draw it. You see. Now, you see this, we have started from where the sperm is fusing to the ovum, and then we are at the morula, which is the formation of the ball, and then the blastocyst, cell starts to form, and then after cell starts to form, it is implanted to your uterus. After being implanted to your uterus, you form what? A bigger cell that has layers. These layers are formed into ectoderm, mesoderm, and endoderm. Inside your uterus, ectoderm, mesoderm. I'm going through this so that people can understand how, when I start talking about autism, we will understand how these things form and they grow. You get? So they form ectoderm, mesoderm, and endoderm. So the ectoderm forms the neural tube, the ectoderm. the ectoderm. The first one forms a tube. It forms a neural tube. The mesoderm forms something that is called a transforming tube. You get a transforming tube. We will see about that. This is just an overview of process of formation of a baby. You get. So fetal period starts by week 9. So the neural tube is the ectoderm, which forms around. So this is how your baby comes. And the problems that come in are when people are autistic. The problem starts from the neural tube and the blastocyst. Today we are talking about autism and how it comes. So it is very important to understand how a child, let me repeat, if you are a new person here today, here we talk about medical issues. So today I'm talking about spectrum of diseases, and I've started with autism. And before autism, it is important people get to know how a baby is conceived and then how it forms. So this one is a sperm getting into a woman's ovum. Then it forms some lines like this one, which is called morula. And then the morula, this line turns into cells now, which are transferred and are implanted to the uterus of a baby, of a woman, uterus of a woman, where now they form layers. These cells form layers: ectoderm, mesoderm, endoderm, and then it forms something that is round. It is like this. It comes like this. You see this ovary that has formed a round thing. It forms a round thing like this. So the ectoderm is the outer part. So it forms a neural tube and gets in like this. So when it gets in, it was ectoderm was up, but when it forms a neural tube, it gets in and then it comes like this. So inside is where now you start forming the layers of the mouth going down to the stomach up to the anus. And then the other one, which is the mesoderm, start forming the hands, the legs, ears, and the endoderm start forming some measures, some organs. That is how a baby starts from inside. So if you are new here, you know what we do here. We talk about things that are medical. If you have heard about that and there is something you have not understood, this is just an overview of embryology. How a baby starts to form right from conception. After the sperm fuses with the ovary, there must be some things that happen before now a baby is formed. So we have said, let me repeat before I start, autism and how the complication begins. You have made love with your woman, the sperm has gone into the cell, it has formed a big ball with lines inside called mesoderm. So it comes and forms a blastocyst. These lines that are formed, these form cells, a lot of cells inside called a blastocyst. So those cells are implanted into the uterus. After they are implanted, they align themselves now well. They align themselves well, and then they form the ectoderm, mesoderm, and endoderm. They form the ectoderm, mesoderm, and endoderm. This is where now life begins, after those cells have formed. Because when now the endoderm, mesoderm has formed, this is where the folding of the cell, and then you start having hands, the umbilical cord, you start having the ears, you get. But the endoderm is the neural thing. It's the main thing that forms the neural tube gets in, and then now after it gets in, it's organs, and that is an overview. It's just an overview of the normal embryology, how the cells migrate and then they form a baby. How the cells migrate and then they form a baby. Now there is something called autism. Let's start with autism. We have named several spectrum diseases, and I've showed you how an overview of how a normal thing goes, how a normal embryological process goes here, how a normal embryology, it's a very complex situation at times, but this is the easy way we can talk about it. Okay, now let's go to what is autism. From the cellular, from what we have learned, what is autism? Autism is at the cellular level is complex, and it involves abnormalities in the brain development. Nicholas Journey Extras, hello Benjamin and everyone in the chat. Nicholas, welcome. Today we are talking about autism, and I've just said how a baby, when a sperm gets into the ovum, how it is formed into a baby. A quick overview. So it is about the brain, synaptic function and neural signaling here. And when neural tube, we have seen the first layer, which is the ectoderm, is which makes the neural tube, and there are some pathways that signal it before it starts folding and going inside. So this one, during early brain development, when the ectoderm has gone in, now those are cells, a round ball that are implanted into the uterus. When the ectoderm goes in, there are some things that happen. The neural migration is disrupted. This is how autism comes. When it is when the baby when the ovum is implanted into your stomach, you have made love with your person you love, and then it has formed a morula, and then it is implanting. Now at this step, when the neuron is forming and getting in, when this step it is forming and getting in, this is where the problems begin. When I say the pathophysiology, this is where the problems now begin. The neural migration is disrupted. Neurons may end up in the wrong cortical layers. Because if we have seen, this is the outer is the neuron, and then it is going in. Remember what we are talking about. We are talking about a blastocyst that is implanted into the uterus of a woman, forming a child, and then maybe when it is getting in, when the ectoderm is folding to get in, some things happen to this child, maybe genetic. Let me get this, because someone may ask that question. So when they are disrupted, remember they are cells, and they are going, and that's why women get folic acid when they are pregnant, and some supplements to make the process go in a good way. So autism starts from conception. It may start from conception, when the child is forming in your womb. You see, from that step, the neural cells are disrupted as they fold, going in to form organs. And inside is where now this layer that is going inside, forming the neural tube. If you are watching, not understanding what we are talking about, today we are talking about how autism starts, how autistic complications start. And I'm just naming how it starts from. How a person is disrupted, and then the brain end up having a problem. Now you see, when it is forming and going inside, if any cell, even one cell, is disrupted, it may end up being left on top or being left somewhere. So the layer that will form a brain, because you see, this hand, I'm taking it now like I'm taking this hand of mine as the ectoderm, mesoderm end that is implanted in the uterus. So this one, I'm taking it as a hand. I want people to understand this. You see, when it is going inside, it is forming the layers that are inside this ball are the ones which will form organs. And the organs that will be formed, they start from the brain, nose, inside, from the, you get, internal organs. So as they form internal organs, the mesoderm sprouts, and then it forms hands and legs. And then there are some things, little things that endoderm do. You get. So if you are coming in right now, there are some, we are talking about medical issues here, and today we are discussing how autism starts. So whatever I'm explaining is autism from cellular level, from the day a sperm meets an ovum, and then the complication that occurs when the folding of the layers come, and then the child starts to form inside the womb of the mother, the uterus itself. So if you are new, I can see new people are here watching. If you are new, please hit the like button and let's learn. If you are new, hit the like button and let's learn. Don't forget to subscribe. If you have a question, you can ask anyone at the chat, or you can ask me directly any medical question. But today we are talking about a spectrum of diseases that are born from conception. So what can make these layers, you have understood, what can make these layers to do what? To be disrupted. Let me draw a forming layer so that someone can understand. Now imagine this is the ball, and this is now how it folds. So any layer that will go inside and fuse inside the ball. So the forming is this. You see, this was the ectoderm, mesoderm, and endoderm. After they have, ecto is outside, mesoderm is inside, midway, and endoderm is outer. Now this one folds in, and the other side forms in. And then inner part from this downward here is where now you start having forming of organs of a baby. But the process, when it is continuing, what happens? Maybe some things happen. What can cause this ectoderm layer, forming the neural tube? You know, it is a migration of cells. They are the cells that migrate. When they are like this, it's not like a ball that is fusing. No, it is cells that are many cells. You see how I've drawn here? There are cells that are many like this one that fuse and start to migrate going in. So when they are going in, that is where problems come. We have genetic issues when a person has this problem. Most affect protein responsible for movement, signaling, or structural support. You get, there are some proteins genetically people have in their genetic makeup that may disrupt the process of folding. So you find one cell or two cells have been left up, and they are mesoderm cells. So if one cell or two cells, yes, T, welcome to the platform, welcome. Today we are talking about how autism occurs right from conception. So if you have a question, you are really welcome, and you are welcome to ask anything. Let's go slowly. Now you see, if this is the normal migratory pathway, a sperm and ovum, it fuses, it goes inside, then it forms a morula. The morula forms many cells. CJ Rehab, Grand Rising, welcome CJ Rehab. Now these cells are many. It forms a ball of cells. and that ball of cells is what is implanted into. Hello CJ, welcome. Today we are talking about autism. These cells are the ones go to the uterus. These cells, blastocysts, they go to the uterus, and then after they are in the uterus, they form a real ball now with the layers of cells. Those layers of cells are the ones which make a baby. Those layers of cells are the ones which now come up with a baby. You see, me draw so that, drawing sometimes help people to understand. And if you have a question, I want people to understand spectrum of diseases like autism. You get autistic spectrum of diseases. Now, when these cells are like this, the top layer now starts to migrate, and it starts to migrate like this. These ectoderm cells, they start to migrate like this. So there are some proteins in a person. There are so many proteins, like LIS1, there is renin, abdominal cortical layering, DCX, conscious subcortical band heterotopia. You see, every protein has got what it is aligning as the cells are going in to form now a baby. There are cells that migrate. These are cells. But remember, these cells are in the uterus. Major, welcome to the platform. Today we want to understand autism. It is not that when you implant this ball of cells, which is a blastocyst, it forms layers and then they start to fall. No. There are special cells that are called ectoderm, mesoderm, ectoderm and endoderm. And then these cells now, they start forming what? The migratory cells that get inside, and then they start forming the layers that you always see. Come up now with the hand, the legs, with the stomach organs, and even with the brain. Like, let me give an example of a protein that is called renin. Renin comes up with abdominal cortical layering, the inside, from the mouth, from the esophagus down. You see, there are proteins that are making diversions to form a baby. Now, as they migrate, the ectoderm cells, the upper layer cell, this one, it forms this tube. It looks like a tube, neural tube. So there are some things that can make that tube to leave some cells up. And then, the tip of the cell, the tip down here, which comes out with the brain, you see, the cells go in, and then the first thing that starts is the tip, which is the brain. You understand? That is how a baby comes up now. Now, when the tip, one cell is left out, it means the brain part will not function as normal. And what are the things that can make 1, 2, 3 cells to be left out or to be disrupted from the way of folding of the human when the blastocyst is implanted into the uterus? If you have not understood that process, can I repeat, guys? Can I repeat? If you are here and you feel I need to repeat, I was starting I was on autism, but for you to understand autism, you need to understand embryology, how the sperm and the ovum, they fuse, and then when they go to the uterus, they start forming a baby. You wonder why a ball may just come up with hands, legs, nose, stomach, the brain. You understand? Can I repeat about that process before we go on? Anyone? Okay, let's continue then. Let's continue. But I can repeat. This is it. The sperm, you have made love to a person. Sperm gets into the ovum. It forms a ball called the morula. This morula, they start forming cells which align themselves, which is the blastocyst. So this blastocyst, it will implant itself to the uterus, and then it will form cells of layers like the ectoderm, mesoderm, and endoderm. And then these cells will start to migrate inside. The one that a ball, imagine a ball that is going inside itself. So the upper cells, which is the ectoderm, starts to go in. So the inner part is where you start having the layers and organs of your body. And there, I've said, as it is going down, you see, as it is going down to form the layers of your body, what happens? Something may disrupt this tip, the ectoderm, leaving some cells up disrupted or destroying some cells. And you know, the tip may be the part that will come up with the brain. So there are genetic problems that may bring that people may carry from their genetic line, like DCX, which called subcortical band heterotropia in the brain of a person. Those are some patterns in the brain. These genes regulate microtubules and cell adhesions and guidance signal. The LS1, those proteins. So if they are disrupted, the signaling of the cells, how they migrate, may be not normal. It's genetic now. Just know, if you are born with mutation of some proteins like renin, DCX, and LIS1, it may destroy the fusing. It may, J-Hang47, welcome J-Hang. It may disrupt the fusing and inner transformation when it is forming. The cells are migrating to form the neural tube. So there are sometimes a parent may have infections. Infections may, when you are pregnant, they may cause those cells to be disrupted. Which cells am I saying? The cells that form the neural tube, the endoderm cells. You have a baby, you are pregnant the first weeks, and then you are at the week, the 6th and the 10th week, and it is implantation week, and then you get an infection. So there are infections like toxoplasmosis, cytomegalovirus infection, HPV, and rubella virus. They may affect when the tube is getting in, and it may affect the head, and the brain. So this intrauterine infection may cause inflammation, the neural death, the death of the neural tube. The neural tube, you see, we said ectoderm comes up with the neural tube, which forms the organs of the baby now. So these viruses, toxoplasmosis, rubella, cytomegalovirus, may make this neural tube to die, and then, or part of each of the cells to die, and then you may come up with a baby that is not folded well, or the brain is not functioning well. Another thing is hypoxia. Hypoxia, we say, is lack of oxygen, reduced oxygen, because maybe the placenta that the woman has a problem, because when this thing, the morula, gets in, and then it forms those cells in the uterus of a woman called the blastocysts. The blastocysts, you check the blastocysts when they are implanted, they need oxygen to make energy and to transform into a baby. The transforming and the folding needs energy. So when it needs energy and the woman has problems with the placenta, it is called placental insufficiency. They lack energy to migrate and form the tube that comes and forms the brain. So they may migrate so slowly. And they may get impaired. So if you are wondering what we are talking about, my friends, we are talking about how autism starts right from conception. And you have seen autism starts right from conception. You see, when the sperm fuses with the ovum, forms a morula, forms cells, a ball of cells that are called blastocysts, and then they are implanted into the uterus. You get? If you have a question, please don't fail to ask. Just any question that you fail to. I'm kind of like trying to explain in a language that everyone can understand about how autism starts, because we are talking about autistic disorders. So when it gets it is disrupted maybe by oxygen insufficiency, because you remember a child oxygen is got from the mother through veins that bypass the liver, umbilical veins that bypass the liver, and they come into the placenta, and then this child, the mother, supplies oxygen to the baby through those veins, through the umbilical cord. So the mother's blood is supplying through the child. The child gets nutrients, the child gets, and you know, when the child is in the womb, the lungs are not functioning. So the placenta is the one which, when it starts to form, supplies oxygen. But at this level, the cells are still migrating and starting to form, and others want to go up and form the placenta. So disruption by not getting enough oxygen is a crucial thing to this baby. And then we have some things that people do when they are pregnant, like taking alcohol, drugs like cocaine, and exposure to some heavy metals like lead and mercury. You get, this may hinder the migration of our ectoderm to form the neural tube that comes up with organs. It may disrupt the normal, and the child may come up with autism spectrum, because the brain itself has a problem. Radiation and nutritional deficiency. Women, when you are pregnant, or your friend or anyone who is pregnant, please don't fail to take supplement as like folate. Folate is a very important thing when a woman is pregnant, because folate helps to create DNA, and you know the DNA is the cells themselves that migrate and form that baby. Folate is the cells themselves. It helps the DNA of it to form, so that as the cells are migrating, you know, at that time so many things are happening. The DNA is forming, more cells are being multiplied, and the mother, through the meiosis. So the mother is kind of like needing more supplements. So folate is the main thing that helps the DNA too. So you may not even take the iron because of reduced, but never lack folate in your diet. General malnutrition, women that are malnutrition and they are pregnant, no folate in the body, no iron, and the transfer of the ectoderm cells are forming the brain, endoderm, and you don't have, so the DNA is not being formed as normal. You get abnormal glial function. Neuron migrate along radial glial fibers. So this neuron, instead of migrating normally, it migrates along radial fibers, the other side. So you get the brain that is formed, it is not formed as the normal brain. It may function, but it is divided, or it is insufficient. You get? Now we are talking about things that may affect a person, so that this person gets into something called autism. And then the signaling, because when they are growing, there is something called the signaling pathway. Calcium signaling, telling cells go this way. You don't have enough calcium. Neurotransmitters like GABA in the brain are less, and it's genetically, you've carried it from genetically. So those are those are things that can make a person to get autism. There is something like immune and inflammatory response. Maternal immunity activation can alter the brain development. You've seen some mothers when they go to the hospital, they are given an injection to reduce the immunity. Not the other one, which is called the rhesus isoimmunization, the one of O positive or negative father, or O negative or negative. This is when your immunity is fighting against the ovum that is implanted into your uterus. Now, let's go to autism. Those are the things that can happen. So there are some things like the synaptic dysfunction. When they are forming, there are some things that bind. Efasi Lipenga, welcome to the platform. There are some things that bind. But you find that these synapses don't bind well. So you find that this brain is not functioning as normal. Exhibition imbalance. That one is, we have said the neurotransmitters. We always talk about GABA glutamate and GABA. They help when it comes to transfer of these cells. These cells, when it is forming, to the neural tube. You know, a body of a person starts from a tube, and then inside the tube you get organs, outside you get skin, and then there is a layer that comes out with functional organs and hands and what. That is how a person is formed. So you may get that some things like glutamic activity and reduced GABA inhibition, those neurotransmitters in the brain, that may make the brain not to develop well. Abnormal transmitters, neurotransmitters. When I'm saying neurotransmitters, I'm saying about the ones like dopa, serotonin, elevated in blood of some patients. They can injure the migration of the cells. And you have said the migration of the cells come out with ectoderm. You see, this is how things happen. From fusing, after fusing, you end up having morula, cells form. The morula, the cells now are implanted to the uterus, and then it forms layers. The cells themselves, after signaling pathways that were, they form the layers, and then the layers they get into the cell. They now fuse inside. So this ectoderm fuses inside to form now organs, and then the organs from the mesoderm and ectoderm, they form other things like hands, legs. You get that? This is how a baby is formed. But what I'm saying is all this that come out is what forms the dopa signals. These are, even you where you are, you understand you have something that is dopamine in your brain. And dopamine is the main thing that comes low or overreactive in people that have Parkinson's disease. Serotonin, when it is elevated in your blood, GABA. Those are things that make you reason well and balance your thinking normally. They make you reason well and balance your thinking. So when they are not normal, what happens is you start having problems with, if you are a woman, the baby that is inside your body, your uterus. The defective pathway, we have some things that are called mitochondrial dysfunction. You see, the cells that are maybe in your family, you are giving birth to this, you produce cells, one of the father or the mother is producing cells that the mitochondria does not produce energy as needed, because the mitochondria, we always knew that in a cell it is what is called the powerhouse, give you energy through production of ATP. So in your family, you don't do what? You don't give out cells that have energy. They are reduced. They are reduced in energy. They produce reduced energy. You see? So as you grow and you grow, you start finding that the coming in of the cell is disrupted. The ectoderm is disrupted. And what happens when it's disrupted? When it is disrupted, what happens? You have a problem of now forming the brain and the other organs. You know, we don't just talk about autism without knowing where it comes from. People may say that it is a genetic thing, it is a thing that people are born with in family. But now you see, several things that are coming out after our discussion are telling us that even a family that does not have autism, you can get autism. You can get autism through what? Altered functions. You have seen alcohol, you have seen stress. When you are stressed up and it can make when you have stress, your signaling pathway like serotonin, which gives you happiness from your brain, it can make you not to have the normal transfer of ectoderm cells. Anyone with a question up to there before I continue? I can see people are listening slowly and slowly. People are listening slowly and slowly. How did you think autism is? How did you think autism is? Let me give a chance before I continue. I know today's topic is becoming so complicated. If anyone has a question, I'm giving a chance to ask. I wanted people to understand how a person gets autism right from conception. How a person right from when the sperm gets into the ovary. Are we understanding that process, or it is complicated? It seems complicated, yes? Autism starts right from the day your sperm gets into the ovary. Neural tube formation, and we have said neural tube formation starts from the endoderm, the ectoderm. This one, the ectoderm. It starts from the ectoderm. If we start going deep into this, it's a very long process, but I've tried to minimize it as per how things go from the start. It's the easiest way you can understand autism. And let me repeat about it, so that when as we continue learning about characteristics of autism, you may understand and how to diagnose. You see, let's go again slowly about autism. You see, this is the sperm, this is the ovum. So the sperm gets into the ovum, the tail remains. And then after the tail remains, you get something called the morula. Now this morula that is here, it forms cells, many cells that now starts to align themselves around the big ball that is going to be transferred to be implanted. Maybe this morula is somewhere here. maybe it is somewhere here, coming to be transferred, implanted here. And then when it is implanted, now the cells that had formed to the blastocyst, they start to align themselves like this. Cells that are of ectoderm, cells that are like morula, cells like endoderm. You see? And then the ectoderm, they start to fold inside. They start to fold inside like here. You get? Now here from the tip is where you start getting the brain. And you have seen there, that is how a baby forms. FRC is saying, great topic. I studied about different types of disorders when I was doing my level 7 psychology. After my son was diagnosed with level 1 of autism spectrum disease. Okay, you see, you are at least now FRC, you understand where it starts from. You understand it starts from the inside. Disruptions of cells that are migrating and going inside the cell. You get? Now let's check it out. How can we diagnose this? We have seen how the normal cells are done, but now we want to know how we can diagnose what? We can diagnose the complication. How can we diagnose the complication itself? How autism is diagnosed? How is it diagnosed? We developmental screen. First steps. Because now you cannot diagnose it when the child is growing, because when you are doing everything that you are doing, you will find the child is growing well, the heartbeat is okay, and you never know about the formation of the brain, but the growing of the baby inside, because the ectoderm has formed, the mesoderm has formed, the organs, the child is growing. It is done in the early childhood. It is done in the early childhood, often 18 to 24 months, when the child is born. We look at, when you look at the child, no eye contact. You know, we talked about cranial nerves that come from your brain. You get? The cranial nerves that come from your brain are the one which innervate everything that happens around your eyes and down from the vagus nerve that goes to the stomach. Now, we have olfactory. Olfactory is a nerve that comes from your brain that controls your the olfactory, smelling. Optic, the one, it's a nerve that comes from your brain that controls how you see. Olfactory, optic, oculi motor. That one moves eyes. You get the muscles of the eyes. Olfactory, optic, oculomotor, trochlea, or again helps with some things that move the eyes. Trigeminal. Thank you, doctor. The refresher class is appreciated. Welcome. We want to understand. I'm going slowly because we want to understand about, because people talk about autism and they don't understand really is it a disease, or is it a complication, or is it a what? You see. So when everything has formed, you see, like this, when it is disrupted, and you see this thing is inside the uterus, it will continue forming. But you remember one cell or two have been disrupted, but it will continue forming. When it is continuing to form, what will happen? Some of the cells that come up with the cranial nerves come from the brain and they drop like this and they go to where they are supposed to innervate. So the nerves are controlled from the brain. But you remember our brain had an injury. So if our brain had an injury somewhere, what do you think happened? It injured some nerves. So let me go through the cranial nerves. There are 12, so that we understand how autism is classified. And I've said you cannot classify autism before the child is born, because as you go to ANC clinic, we call it antenatal clinic. The child is growing well, the heartbeat is okay, it's growing. So after conception is where you come and realize there are some things that are not adding up. But you see, those are micro things started from the cell, when the cell was forming the brain. When you and your husband made love with your boyfriend, maybe the signaling proteins that your boyfriend had in their families, they were not doing well. The signaling, telling these endoderm cells, now go inside, now migrate to the left, now migrate to the right. We have a problem with that proteins. Those proteins are named. And another thing, you may find some people in their family, they are born with, these are cells, and inside the cells we have mitochondria that gives energy. So the mitochondria that give energy, some people are born with maybe the sperm cell, or Ridley passing through, good morning everyone, morning Ridley. So you may find that some people are born with their sperms, or the mothers with their ovaries that are producing cells that are not giving enough energy for the process to go on well. That is another thing. The third thing is lifestyle. Alcohol, drugs, you are taking drugs and they disrupt the process. You see? So as the process is being disrupted of forming the baby, some cells go where they are not supposed to be. You see? And that's where we come. If the brain is forming and the nerves that help us to do some things and be cautious are coming from the brain. You get? The nerves come from the brain. What do you think? Some people will not have innervation. It depends with where the problem is. That's why it is categorized in levels. It depends with when the ectoderm was forming the neural tube so that it can go inside and start forming organs. Which cells were disrupted? Which cells were not going at the right place? Now, if you are affected at the end when we start from here. So here, or end of the brain, where it starts from, the brain looks like this. So here is the front where we have the olfactory, the first cranial nerve. Cranial nerve only means nerves of they only mean nerves of the brain. So it starts from the nerve of the brain here. Maybe the one of the cell that was migratory was disrupted and it was coming here. Now you find that child cannot even have smell. It is called olfactory. Olfactory is a nerve that helps smelling. You find that child cannot smell. Optic for vision. Next to the cell, the brain here, olfactory, we have another one called the optic. So the optic, the nerve comes and it joins something called the optic chiasma to here to the eyes, so that you can vision, you can see well. So if that cell was disrupted at where the nerve of the vision comes from, you will have problems with innervation of eye. And just immediately after the optic, we have something called oculomotor here. As you see, we have eye movement. So the eye movement may be affected with maybe when the neural tube was being formed and the cells were going where the nerve of the eye movement was, and it was disrupted and left on top. So you don't have strength, and that's why some autistic children, you will see some eyes are like this or like this, because the nerve that is called the oculomotor, the cells were disrupted. So that nerve was not complete. So eye has gone this side because maybe that nerve is not innervating one side. And then we have trochlea, superior oblique, oculomotor. From the three, after olfactory, they arise from around the same place of the brain. Optic, oculomotor, and trochlea. Optic, oculomotor, and trochlea, they arise from the same place, around the same place, because they are innervating the eye, like the oculomotor, eye movement, and pupils. The pupil constriction. When you are in a dark place, they become big. You have ever seen a cat? When a cat is in it goes into a place with light, the eye becomes big. When it goes to a place that is dark, eye constricts. It's the work in human, it is the work of oculomotor. So the three nerves, oculomotor, trochlea, and trigeminal, they arise around the same place. Trochlea comes from somewhere here. So it helps oblique muscle. It makes your muscle not to go inside like this. It makes your muscle to look straight. That is trochlea. Trigeminal, facial sensation and chewing. Now, you have seen some children that are autistic. Chewing is a problem. Chewing is a problem. Or you'll find they kind of like are like this. Why? Because there is a nerve number 5, which is called trigeminal. It comes and it divides itself into 3. It comes and innervates the mandible. It comes to the eye, ophthalmic, and it comes to the facial here. So here, the face, sensation of the face here is innervated by trigeminal, facial sensation. That's why when you touch yourself here, you can feel here. And then the mandible, you can chew. You've met some children that are autistic and they can't chew, or eating is a problem. It's because when the ectoderm was transforming, maybe the disruption happened where the trigeminal nerve was. You see, maybe it happened where the trigeminal nerve was and it got disrupted. So if it caused a problem with facial sensation, or this child eating, you see how the characteristic of an autistic child is graded just through this. Let's go to number 6, abducens. Abducens is eye movement. We are still in eye movement. So optic, oculomotor, trochlea, 3 plus abducens. Number 6, both they control eye movement. Lateral lectures, it makes your eye not to go up or to go down. Lateral, so it makes your eyes to be straight. As oblique is pushing this, it is making this to push this, and your eye to be straight, to look straight. So some eyes of some autistic are looking down or are looking inside. Depends with where you have a problem. You get? Now let's go to Hilda Taylor. Dr. Benjamin, blessings to you and everyone in the channel. Welcome Hilda. Now there is another called vestibulocochlear. Now all these things I'm talking about the disruption. As they migrate, as these cells are migrating to form the neural tube inside, and they are disrupted when these cells that are in the uterus of this ball are migrating to form inside. It depends with where. My son had speech delay. He started speaking full sentence at the age of 6. You see, let me continue about the cranial nerve, and you will know why. We are at vestibulocochlear. You have seen some children that are autistic. they can't walk well, delayed milestone, and balancing, because one, the migratory cells, maybe it was genetic or infection or alcohol intake or drugs or something genetic that disrupted these cells, and it disrupted the cells that were going to make an area where vestibulocochlear nerve that comes from the brain will serve the ears. You know, this is case that called autism. It is called autistic, really autistic. Now, your ears help in balance. Your ears they help in doing what? Your ears help in balance, and they help in. Hello, it's Choya. Welcome to the platform. Your ears help in balance and they help in hearing. So the vestibulocochlear cranial nerve number 8 is what is responsible for that. So your autistic child may not have good balance. Glossopharyngeal, tongue and swallowing, number 9. Vagus, control organs like the heart, lung, and digestion. Accessory, shoulder and movement. Hypoglossal, tongue movement. Those are the 12 cranial nerves. So, can I repeat, my people, so that we understand? I think everyone, am I clear? At least I'm driving a point home, At least I'm driving a point home. In simple terms, we have 12 cranial nerves that arise from your head. 12 cranial nerves that come from your head. And they help you to do some things like, we have said, smell, vision, eye movements like trochlear and trigeminal, facial sensation, abducens, eye movement, you get all those like vestibulocochlear, hearing and balance. A human being has 12 cranial nerves, and when it comes to autism, 12 cranial nerves, and when it comes to autism, this is where it starts. When your sperm has gone to the ovary, it has formed a morula. A morula is a ball, a round ball. Then after 2-3 days, it forms something called a blastocyst, a mass of cells that are implanted into the uterus. When they are implanted to the uterus, they start to separate, forming layers. The upper one is called the ectoderm. This one is called the mesoderm. And then this one is called the endoderm. So what happens is, after 2 weeks, the ectoderm, they start to migrate inside the ball like this. So the inside part is what forms the organs. And this process of migrating, forming this tube that is called the neural tube, the process of migrating, forming the neural tube. If you are listening here, we talk about medical issues. If you are new, check if you have liked and ask a question if you are not understanding. Just check if you have liked and you are not understanding, please ask a question. So when it is migrating, now autism starts from here. This, you see here, this is where autism starts. Because as the ectoderm gets in to form something called the neural tube that comes out with organs like the brain, the spinal cord, this inside here, some things disrupt that process. And you know there are cells that can move. So something like nutrition, you have not been taking good care of yourself nutritionally, folic acid can cause you to have poor migration inside. And when you have poor migration inside, what happens? You start having problems. And where the cell was disrupted is where you get a complication. And I've said clearly, your brain have 12 cranial nerves, And you have seen, let me repeat, cranial nerve number 1, olfactory, starts from the front. Innervation of smell. That's why when you are hit here, sometimes you lose sensation of smell. Number 2 is optic, vision. It helps vision, you to see. Optic chiasma. Oculomotor, eye movement. Trochlea, still eye movement. Superior oblique, the muscles. Trigemina, facial sensation, and chewing, because it's divided into ophthalmic, optic, and mandibular. Ophthalmic, facial, and mandibular. So when trigemina comes and reaches here, it divides into eye, facial, and mandibular. So the one that comes here, it's a nerve that is divided like this. So this one helps your nerve to come up as you chew. Some children don't know how to chew, autistic children. That is trigemina. Abducens, eye movement, facial expression, anterior tongue. So facial, there is a nerve that is called facial nerve number 7. When it comes up to somewhere here that is called the concha tympani, and then it helps the nerve from here to 2/3 of the tongue. You can feel taste, you see. And then facial expression, when you smile, it's the one which gives you a smile, makes you feel down. The facial expression. Vestibular cochlea is the number 8. Balance. Number 8. Balance. Glossopharyngeal, the tongue. Posterior tongue, from the facial was serving the here to a 3rd. So glossopharyngeal move the tongue and serves from the 3rd that is remaining and swallowing. It helps you even to swallow that nerve. Vagus nerve, things like the heart. When we are talking about the heart, you saw it was doing something about parasympathetic system, lungs, and digestion. The vagus nerve, it was called the vagus nerve. Why? Because it helps the brain, the heart, and goes up to the stomach. It is everywhere. Number 9, that is number 10. Number 11 is accessory, which makes you brush your shoulders. Number 12 is hypoglossal, tongue movement. Now, according to what I've said, if anything on the brain was disrupted somewhere where these nerves are coming from, is how you depict a child's problem, is where you pick where your child's problem is, and it comes with the grading. You see, the development and diagnosis of an autistic child comes from where. Anyway, before I go to how it is diagnosed, people are listening so calmly. Can anyone have any question from where we started? How your cells are merging? What do you tell me? What do people say about the autism? What do people say about autism? About what autism. How do people speak out about autism? Like Efasi said, Hassan was diagnosed with autism. What did you think it was at that moment? What did you think it was? Level 1. It was level 1. Yes, she has said level 1. But I've seen several people talking about several things about genetics, myths that are there. The myths that are there, and even some people don't understand how autism itself begins. Now you understand it starts from the neural development, when the tube that forms the hand, the legs, comes out. You get? Anyone with a question up to there before we move on? Because, you know, a session that is interactive is good. When you listen so much and you don't ask questions, I know you have a lot of questions. Let me listen to one question or two before we continue. Let me get one or two before we continue to diagnosis. Anyone with any question? You know, it's good to understand. Even sometimes the diagnosis itself, sometimes diagnosis of autism, it's a complication to some medics, even to some doctors. Because now you can confuse autism with some greetings to you all and everyone in the house. Levels of autism are many. They can go up to 7. Let me get. I can see Jamaican uncle in the house. I find it very interesting the way how the body function and how now you understand really. Your body started as cells and now and the cells that are migrating, going inside and then they come out. Now, Maje has asked a question, how much levels are there? The normal ones that people know are 3. The normal ones are 3, requiring support which is mild, level 1, but FRC has told us, requires substantial support, moderate, and requiring very substantial support, severe. But we will see of other levels. But for now, just know there are 3. I think Ridley is getting Ridley is surprised on how levels occur. Welcome, Jamaican uncle. We have been discussing about how autism starts from conception, from when you conceive to the time the baby is born. So the diagnosis always comes after. Manje, I hope I've answered your question. For now, let's know about the 3 normal levels. But as we talk and talk and talk, I'll introduce some levels. Now, it is a complicated thing because, you know, when a cell is disrupted at this point of growth in the uterus, when a baby is growing, you cannot know, but it can create a very complicated thing in future. And it depends with the neural tube where it was disrupted. You see, if it was disrupted at any level of the 12th cranial nerve, is what depicts outside, and how much of the toxin or disruption was there. That is what it depends. How much of disruption and how much of you get. I don't know if I'm driving the point home. Because someone that has used cocaine and has convulsed and there is a woman having a baby can cause a huge disruption. A person that has a genetic problem of concept of when the ovum and the sperm are fusing, you know, let's say this is a ovum, this is a sperm. When it fuses and then the tail is left, you may find that they fuse and then they form a big ball of cells. So you have seen something like mitochondria, my lucky nice. So it slows down the process and the cell of the cells die. So it depends with how the problem started, and it is diagnosed after the baby is born, because you will start seeing. I know a woman who is bipolar, have 2 daughters, both of them autism. Yes, it is, you know, even bipolar is in there. When I started, let me start again because I can see. We have said that brain complications are made, and I said we have this. Listen, we have autism, we have schizophrenia, bipolar spectrum, obsessive compulsive and related disorders, substance and use disorder, anxiety disorders, attention deficit hyperactive disorder, eating disorders, personality disorders. I learned that mother's age can also be a contributor factor to have an autistic child. Yes, it can. Because we have personality disorder, and we have the ones that are coming from neurological development spectrum, the brain, fetal alcohol take, intellectual disability, medical and chronic kidney disease, chronic obsession, and even COVID, virus. So FRC has said, so imagine if most probability of people that are bipolar and are women. Welcome, coffee cakes. Welcome to the platform. We are talking about how autism starts right from conception. Mothers that are bipolar, it is official. We will talk about bipolar. You will see it is the same thing. The progression of cells in your brain that were disrupted during migration. Let me repeat this. You see, this is a normal chart, how a baby is born. I'm repeating because I want people to understand. A normal one, you get? In this way, the sperm gets into the ovum, it forms a ball that is a morula, and then this morula forms many cells, a ball of cells that migrate after 3 to 5 days, 6 days. They are implanted into the uterus, and then when they are implanted into the uterus, they form layers, and these layers are called ectoderm, mesoderm, and endoderm. Ectoderm, mesoderm, and endoderm. So when they form ectoderm, mesoderm, and endoderm, after 14 days, now the ectoderm is signaled by specific proteins. Now start migrating. The cells start to migrate inside like this, forming something that is called the neural tube. Forming something, you see how they migrate like this. So inside, whatever that is going to the tip, it is what will start to the brain, forming the spinal cord, and inside the mouth, and then the other layers will form the hands, the gastric layers, and all sorts. You get? That is how a baby starts to form. So when the ectoderm is migrating, ectoderm cells are migrating, and you are taking alcohol, and you are pregnant. They may disrupt the movement, and some cells may not get inside, and the brain function may be interrupted. Look, when the heart beats too fast, what can cause it? The person not walking fast or running. They sit down and they start to beat fast. Okay, I'll answer that. So we have said there are some things that can make a person to have these problems. One is genetics. The signaling proteins are not working well. 2, mitochondria, the energy pathway, the ATP production for the cells to move fast, maybe in the mother's side or the father's side, they don't work correctly. The signaling, the energy. You get? Drugs and alcohol. Oxygen, the kidney issues, infections like virus, toxoplasmosis virus. Those are things that can cause the signaling. Anxiety, we will talk about it. Coffee cakes, you have just started with how the normal pathway, they start, all of these are from the brain. So what I'm explaining is the normal. But I'm saying that the crucial part where anxiety disorder, bipolar disorders starts from this. The fusioning of these going inside so that they can form something that is called the neural tube, which comes with your stomach, your brain, your hands, your legs. You get? This is where autism comes from. This is where bipolar starts from. This is from where the anxiety disorders comes from. Everything starts at day 14, 16. That's why it is important when your women are pregnant, please give them folic acid to make this cell's DNA to grow well and healthy. So the coffee cake pathways, that is where the problem starts from. In the Taylor, I will answer your question, but when your heart is beating faster, what is it called? It is called palpitations. And palpitations can be caused by anxiety disorders. It can be caused by something that is provocative like hypertension. It can be caused by something that is external like fear or panic. Can they take folic acid before pregnancy? Yes. Even you, Manje, you can take folic acid. For men, always take zinc. Yes. Anxiety, tachycardia, and slow one low. Dehydration, very many things. Nicotine and smoking can cause all this. Fever cause palpitations. That is for Hilda Taylor. Fear and panic. There are some things that are genetic like anemia, hypothyroidism, low blood sugar, heart rhythm problems, arrhythmias. We talked about arrhythmias, heart problems, infections, and electrolyte imbalance. So it depends with what is causing. So we have seen all those, and it is very important. Cute Jessie, hello, welcome. Cute Jessie, okay, next week. Your request will come next week. I've seen you and I've told you your request will come next week. We are reviewing some things, so no worries. So those are the problems that we encounter and how autism starts. So folic acid is important for women, and zinc and magnesium is important for men's sperms. If it is not genetic, whereby you have some insufficiencies of some proteins, that you should have to signal, you can bring autism to your sons or girls because of lifestyle. Alcohol, drugs, not eating well, not going for supplements when you are pregnant at an early stage can give your children autism. You get? So, yes, doc, I understand. Thanks, Idatel. So that is how autism starts, and that is how autism. So, as per where you have come, can I get some people? Tell me, how did you think autism started? How, or if you have like FSA, did your doctor explain to you how they started? Because you cannot have a disease without where it starts from. Because so many people, when you ask them what is autism, they tell you it is a disease of the brain. It is a disease of the brain. Anyone who is coming in and you are confused about whatever I'm talking, just ask. It's time for questions. I think it is important that at least I answer some questions so that next time we do the diagnosis and staging. And it's good to go slowly. We have seen some of us in the group that have come out clearly and have said, I'm autistic, my son is autistic, I'm autistic mother, I'm taking care. So it means that if in a small group like us, the way we are talking, there are some that have autistic, it means that autism is there widely. And people should understand the need and how to stay away from these complications. Because now, if you know in your genetic line you have autism, someone has autism and you are pregnant, you will start taking caution immediately. Because if you have problems with the signaling pathway, it means from the beginning of your conception, when the blastocyst is getting into, blastocyst is the layer of cells that are thick, that are being implanted to the uterus so that they can grow. It means you start taking important supplements that will boost. Yes, T is back. T is back. That will boost the cells to have energy, the cells not to delay in forming of the neural tube, so that the brain of that child can grow well. You have seen autism starts from when the cells, imagine at 14 weeks, at the first weeks, at 14, 15 weeks, you have started having autism. Imagine, at 14, 15 weeks, you started having autism. All along, you will not know, but you will come and realize that you have an autistic child at birth. And it's not 14 to 15, yes, 14 to 15 weeks. You see, let me repeat, you see T, yes, Sha is here. Welcome, Sha. We are talking about how autism starts. Let me repeat, this is my schematic drawing that talks about these things. This is the ovary, this is the sperm. It is getting into the ovary. That is the first day of making love. After you've made love, what happens? 3 to 5 days at the fallopian tube. The fallopian tubes are of making babies, making love, making love, having sex. So when you've had sex and these are fused, this is the fallopian tube. They migrate for how many days? For 6 days. After they migrate for 6 days, they are the morula that is formed at the first 4 to 5 days, it forms into a blastocyst into 5 to 10 days. After the 10th day, when it is being implanted here, 7 to 10 days, it is being implanted. After implantation, it forms what? The cells now at the 14 weeks forms this. They put in a layer that forms ectoderm, mesoderm, and endoderm. And now this is where autism starts. The disruption of this endoderm layer coming, this is how they go. You see this? Look at this, and then think of a ball. So at the endoderm starts to go in like this. You see, it starts to go in. And inside this round thing is what we call the neural tube. It is called the neural tube. So when it's forming the neural tube, the cells that are at the tip, they start forming organs like the brain, the spinal cord, and then it forms the mesoderm, which is this one, forms other things like the stomach and else, and this one endoderm forms the hands and other layers. So this is where autism starts, and we have said as it is getting in, the cells, they are not aligned, they must go well inside. Every cell that is an ectoderm must go inside. But you get that maybe genetically you are born with cells that have no energy because their mitochondria are weak. You are born with cells that are problems with some signaling proteins, because that after the 14th day, they must be signaled. They must have named before that starts to make the prick and the others that starts to signal now starts going inside, but they are mutated, they can't signal, so the process goes slow. Some cells are left behind, and you cannot, if these cells are for ectoderm, they are for ectoderm. These cells are for mesoderm, Welcome, Sha. No worries. I know you are at work. No worries. If these cells are for ectoderm, they should be of ectoderm. If these cells were aligned for mesoderm, they should be of mesoderm. And if these cells were aligned for endoderm, they should be of endoderm, because they are going to form organs like hands. Mesoderm, they are going to form organs like the stomach, everything. You get intestine. Ectoderm, they are coming to give you the brain, and so they should go as per needed. They should not be delaying. You get. So this is a crucial. That's why we say immediately a woman has conceived, after 2 weeks to 1 month, you should start the folic acid supplementation. But if you know you have a problem in your family of genetic problem like autism, bipolar, go to the hospital, start supplementation very early. Because that process at 14 weeks to 1 month is crucial. You need energy. Nutrition can make the cells that have no good nutrition to come up with an autistic child. And we have seen the most important thing that we have seen here is your brain has cranial nerves, 12 cranial nerves, and we have gone through the 12 cranial nerves. Ophthalmic, olfactory, optic, oculomotor, olfactory for smell, optic for eye vision, oculomotor for muscles of the eye, trochlear, muscles of the eye, trigemina for chewing and facial movement. You get trigemina, and then we have seen abducens, facial. You get abducens, facial. You get facial. And then we have facial itself, facial expression. Those are if one nerve that arises from the brain, there are 12, is injured. That is how your child will display. Problems with eating. Maybe the place that the brain was developing where the trigeminal nerve is. And I've said trigeminal nerve, when it comes here, it divides into 3. It goes to the mandible, ophthalmic, optic, oculomotor. It goes up to, it helps you to chew. So it depends with which nerve, which cell was disrupted and where was it going. Benjamin, but some are getting autism after injection. What causes that? After injections, which injections and at what age? We cannot, autism is a spectrum of disease that is characterized by age and the disruption and how. Let me get to, after you get an injection and then you start depicting some issues, it means it went and destroyed your brain cells. You cannot say that is you cannot say that is autism. You can get autism from 3 to 8 weeks, 8 to 16 weeks, and you see this is in when the conception has happened, neural migration, misplaced synapse formation. This is 20 weeks after birth. So I would like to tell you, Jesse, that one is a complication that we have a name of encephalopathy. You cannot name that as autism because you were born well, and after birth you got an injection and it brought a brain dysfunction. In real life, you cannot call that autism. You can call it encephalopathy. Like you are injected and then you get convulsions. You have an injection the drug, IV injection, the drug goes to your liver, it forms high bilirubin, it goes to your brain, a child gets something called canicterus. That is not autism. We will differentiate these problems. I've said autism comes right from, and we will see how they come. If you came up early, I said there is autism development during gestation, where we have early brain formation 3 to 8 weeks, and then there is neural formation, the tube itself here, the tube itself 8 to 16 weeks, you get, and then we have neural migration 12 to 24 weeks, where now the neural is migrating, forming now the organ, misplaced neurons forming organs that are not normal. Synapse formation start from connection, the synapse, week 20. You see, that baby is still in the stomach. Now, that is how a simple way I can explain how autism can start. I think if anyone has any question, you can ask, because if I start going to diagnosis after birth, it can bring several. It will take some time, Kenyan time. Cute Jesse will be having a live at Cute Jesse. What time have you said? I'm not seeing it. Let me see. Cute Jesse, repeat. I'm not seeing your text. What time will you be having that live? I'll be in 5 more years before I make babies. T, you will be in 5 more years before you make babies. Okay. But it's good you start knowing these things early. When you get there, you start going to ANC clinics at an early stage. You don't go to an ANC clinic at late stages. Now, this disorder can be managed because it is neural formation and cells that are displaced. Greetings to everyone here supporting. Yes, Everblast, welcome to the platform. What time have you said? I'm not seeing that text of yours. Please text it again. I'm trying to find the time that will be online and I'm not seeing. What time will you be there? I'm looking. So disorder can be cured. You know, there is management. Cute Jesse, I am not seeing. 23 p.m. That is it at night. Okay. The Cute Jesse will be at 11 p.m. tomorrow at night. So please check her out with her content. I've seen, but that is African time tomorrow. So let's get to see that what can make a person have autism. What can make a person start having these problems as the neural tube is forming? What can make a person have this complication when the neural tube is forming? We have said infection like cytomegalovirus, rubella can cause, viruses can cause. I said I will have a premiere tomorrow, Benjamin. Yes, I was looking for time. I've seen it, Cute Jess. There are some immunity issues like high cytokines interfere with neural migration. Cytokines are in Dorothy, reconstitute nikuje kweke. Now, cytokines are mediators of inflammation. So maybe you have a disease that is chronic and it is continuing. A disease that is chronic. So when you have that disease, what happens? You find that it is attacking the cell, the blastocyst. So when the formation starts, it starts interfering with the cells. Hypoxia, placental problems. Your placenta formation has a problem and the cells are not getting enough oxygen. Nutritional factors, nutrition. So women, when we say stop alcohol when you are pregnant, mostly when you are at an early stage, it is very important. Alcohol are disruptors of cell migration. You get fetal alcohol spectrum disorders. Fetal alcohol spectrum disorders. Drugs and heavy metals are problems. So when a doctor says, women, please stop taking alcohol, and you say, I've never had a problem, you carry the baby going to NC, you are told the baby is okay, growing on well, the kicks are okay, and then you give birth to a baby with, and you know alcohol at times suppresses some nutrients like folate, iron, you understand? So when folate is struggling to help you make the DNA of the cells of your baby, what is happening behind the curtain? You are taking alcohol and it's diminishing the nutrients that you are supposed to be having. It's very sad, eh? Smoking. You know, smoking has free radicals and it destroys the cells. Hormonal and metabolic factors. Mothers with diabetes, thyroid disorders. You are supposed to be visiting ANC clinics each and every 2 weeks when you have conceived for the safety of your baby. So that you be checking yourself. Some of you have gadgets that are diabetic at home. Very important. You see? So, from genetics to lifestyle. From lifestyle to disorders that are metabolic that we live with. This is how things are. You get? This is how things are when it comes to these problems. So I asked one day a person that what do you think the problem is when it comes to autistic disorders in your community? And I was told that one is a problem that is given by your community or a curse, or it's a problem of the brain. When my child was born, the doctors, the nurses, they usually say nurses, the nurses did something bad. They didn't handle my baby well. That's why he has, and that's why you see some people that are taking these things to court. And the courts, when it comes to medical problems, it takes that problem to the boards, medical boards, because they are the doctors now. The doctors looks at the case and they know there is no medical worker that had a problem here. This one started from, so when it is dismissed, you start saying, it's hearing people saying, they really, doc, I'm sorry, I have to go, I'll take care of you tomorrow. It's okay, really, we are just about to finish. Have a blessed day. I know you are working. You see, these are the factors that some cases are dismissed. And that is what autism, at least today, I think people, you have understood where autism comes from. But tomorrow we will continue. If I start the diagnosis right now, it will be so, it's a big topic. Like just the introduction has taken us all 2 hours. Imagine if we start the diagnosis now. So who has a question? Anyone who has a question, please post your question as I come. I'm going to put a line. It will take me seconds before I'll be back. So post your question. I'll be here in a second, and when there is early intervention, there is such improvement in child's social life, the emotions, etc. Yes, when there is early intervention, that is very true. I'm coming, just a minute. Yes, I'm back. Any question? Anyone who had a question before we finish? I have 10 minutes. Yes, efforts when it is taken intervention at an early age. At an early age, when a child is born, some cells are still forming, and when it is taken intervention at an early age, those cells start to migrate back to where they are supposed to be, or some brain starts to form. We will see about the early age intervention after the diagnosis. So who wants to understand anything? Thank you for this. It's so informative. Yes, Martin, it's so informative. When it comes, I decided this because I saw to every 10 people that we have here, one is saying that, Doc, I didn't know that autism begins in the brain. I've learned something today. Yes, and please share something. I wish Johnny B. Good was here. I really wanted, although I've not found him on phone, I will someone to share this to Johnny B. Good. We see how things will go. And you have seen for yourself, several people we talk to are saying, like 3 from 10, you see one saying, I have an autistic child, I have this child who is autistic, from 10. So it means out there, when we inform people, when we inform people early, even not before giving birth, when we inform people to take measures earlier, when you have just noticed that in your family you have a genetic line of autism, we can save that. Greetings, Rich. Welcome. Although we are about to end, but it's okay. We are talking about autism. You can save that child not to become autistic. When you have just conceived, you have gone, women, when you have menses have not come to normal, and you go to a hospital, you get the dipstick, you notice it's something is not okay. You get you remember that in our line there is this problem. It's very important to run to the hospital. It's very important to run to the hospital. There are some measures that can be taken so that the migration of the ectoderm cells to forming the neural tube cells can be okay, by giving you some drugs, some supplements to avoid your child being autistic. But it's very complicated at times, and until you realize when this child has been born, then you start therapies, and some therapies are really complicated. So if you're coming in and watching now, here we talk about medical issues. I thank everyone that has come in. And everyone who is watching. Rush to catch up, but I watch. You are like a Netflix, not wanting to miss. Rich, no, thanks. I was explaining about autism, and people are surprised. You see, Hilda Taylor is saying, I did know autism begins in the brain. I have learned something today. Yes. And it begins right from the day you conceive, you see. So, guys, thank you for tuning in. Or is there anyone who has a question? Anyone? Anyone who has a question? Thank you for tuning in. At least we have learned something today, which is so important that people can learn. Can learn and know. So I can come at the normal time after 2-3 hours. That will be at let me say this is 7, 8, 9. After 2 hours and a half. After 2 hours and a half, I can be online to answer some questions. Thanks, Rich. Rich Poo. I will be calling you Sue. Sue is easy. I can come after 2 hours to answer some questions, and then we continue with the topic tomorrow. We can continue with the topic tomorrow. So the topic we continue with tomorrow will be the diagnosis of autism. Today I've given you, thanks doctor, this is very informative. We are learning a lot. Yes, I've begun with how the normal cells begin, then you get implanting, and I've seen today people have learned how a child is formed, how cells go in, then the top layer begins with producing hands. One day I'll go through that process step by step so that you can know how a child comes out in the stomach and forms. It's a very vast process, but this one is just an overview, not a very deep step, an overview. So guys, everywhere you are, if I'll have time, I'll come at 9. You can share this information to a person you love, a person you need. Have a good day wherever you are. Good morning. You call me Sue. Yes, Sue, I'll be calling you Sue. Sue is easy. Everyone who has tuned in, who has liked, and who will rewatch, thank you so much. Let's meet at 9 for answering questions. If you have a question, you can tune in. But tomorrow we'll continue with how to diagnose a child has autism and the staging that Majay has. I will tell you about my nephew who have autism tomorrow. It's okay. It's okay. Thank you, Majay, for that. So everyone, have a nice day. Let's meet tomorrow at continuing with diagnosis. And at night, I'll be here answering random questions. I usually answer random questions at about 45 minutes to 1 hour, 2 hours from now. Bye-bye. See you.